Our bodies have a remarkable way of communicating with us, sending subtle whispers and sometimes louder signals when something is amiss internally. We often look for these signs in obvious places: a pain in the chest, a persistent cough, or a change in our digestion. But what if one of the most eloquent storytellers of our internal health was the part of our body we often neglect, the part furthest from our core? What if your feet, the very foundation upon which you stand and move through the world, were holding critical clues about the health of one of your most vital organs? It seems like a distant and unlikely connection, but the intricate web of our biology means that a problem in the central processing hub of your body can, and often does, manifest at its furthest outposts. Today, we are embarking on a journey deep into this connection, exploring the silent language between your liver and your feet. This is not about causing alarm, but about fostering awareness. It's about learning to listen to your body's signals, understanding that a change in your feet could be more than just a local issue. It could be a crucial early warning, an invitation to pay attention to the silent, hard-working hero of your body, your liver. Before we can decipher the messages your feet might be sending, we must first develop a profound appreciation for the organ they are speaking about. The liver is a true marvel of biological engineering, a resilient and multitasking powerhouse that weighs about 3 pounds and sits tucked under your right rib cage. It is often called the body's master chemist, and for good reason. It performs over 500 vital functions, most of which happen so seamlessly that we are never aware of them until they begin to falter. Its primary role, and the one most people are familiar with, is detoxification. Your liver is the ultimate filtration system. Every drop of blood from your stomach and intestines passes through it, and the liver processes everything you eat, drink, breathe in, and absorb through your skin. It neutralizes harmful substances like alcohol, drugs, and environmental toxins, breaking them down into less harmful, water-soluble substances that can be safely excreted from your body through urine or bile. Without this constant, vigilant detoxification, poisons would quickly build up to lethal levels. But the liver's resume extends far beyond detoxification. It is a central player in your metabolism, the process of converting food into life-sustaining energy. It meticulously manages your body's fuel supply. When you eat carbohydrates, the liver helps stabilize your blood sugar by storing excess glucose in the form of glycogen. When your blood sugar dips between meals or overnight, the liver releases this stored glycogen to ensure your brain and muscles have a steady supply of energy. It also metabolizes fats and proteins. It produces bile, a greenish-yellow fluid that is essential for breaking down and absorbing fats and fat-soluble vitamins like A, D, E, and K in your small intestine. Furthermore, the liver is a protein factory. It synthesizes most of the essential proteins your body needs to function, including albumin. Albumin is a critical protein that acts like a sponge, keeping fluid within your bloodstream and preventing it from leaking into surrounding tissues. It also manufactures clotting factors, the proteins that are essential for stopping bleeding when you get a cut. The liver is also a storage facility, holding on to a reserve supply of vitamins, minerals like iron and copper, and energy, releasing them precisely when and where they are needed. It is a tireless, selfless organ that works 24/7 to keep you in balance. It's only when this master chemist starts to struggle under its workload that the entire system begins to show signs of strain. And those signs can appear in the most unexpected of places. So, why the feet? Why would a struggling liver, located in the upper abdomen, send its warning signals all the way down to the bottom of your legs? The connection lies in the fundamental principles of circulation, fluid dynamics, and nerve health, all of which are profoundly impacted by a failing liver. Firstly, there's the issue of gravity. Your feet are the lowest point of your body, and fluid naturally tends to pool there. A healthy circulatory system, supported by a healthy liver, has mechanisms to counteract gravity and return fluid efficiently to the heart. But when the liver is compromised, these mechanisms falter, and gravity wins the battle, making the feet and ankles the first and most obvious place for fluid to accumulate. Secondly, the connection involves pressure. The liver has a unique and complex blood supply. The portal vein carries nutrient-rich blood from your digestive organs to the liver. When the liver becomes scarred and hardened, a condition known as cirrhosis, it's like a traffic jam on a busy highway. Blood can't flow through the liver easily. This backup creates a dangerous increase in pressure within the portal vein system, a condition called portal hypertension. This high pressure forces fluid to leak out of the blood vessels and into the surrounding tissues, including those in the abdominal cavity, and importantly, the legs and feet. Finally, the connection involves nutrients and toxins. A healthy liver provides the building blocks for healthy nerves and clears out toxins that can damage them. When the liver fails, it can no longer properly metabolize nutrients, leading to critical vitamin deficiencies. At the same time, toxins like ammonia, which the liver would normally neutralize, build up in the bloodstream. These toxins and deficiencies can damage the peripheral nerves, the long nerves that extend to your hands and feet, leading to a range of sensory symptoms. One of the most common and earliest signs of liver trouble that appears in the feet is swelling, medically known as peripheral edema. This might start subtly. Perhaps your socks feel a little tighter at the end of the day, leaving deeper indentations on your ankles than usual. Maybe your shoes feel snug, or you notice a general puffiness in your feet and lower legs. This swelling is typically pitting edema, meaning if you press your thumb firmly into the swollen area for a few seconds and then release it, you'll see a distinct indentation that remains for a short while. This phenomenon is a direct consequence of the liver's failing protein factory. As we mentioned, the liver produces albumin, the protein that maintains the right amount of pressure, called oncotic pressure, to keep fluid inside your blood vessels. When the liver is damaged, it can't produce enough albumin. With low albumin levels in the blood, the sponge effect is weakened. Fluid is no longer held tightly within the vessels, and it begins to seep out into the interstitial spaces between your cells. Compounded by the high back pressure from portal hypertension and the relentless pull of gravity, this fluid naturally accumulates in the feet, ankles, and lower legs. It's crucial to understand that while edema in the feet is a classic sign of liver disease, it can also be a signal from other organs, particularly the heart and kidneys. Heart failure can cause fluid backup in the body, and kidney disease can lead to problems with fluid and salt balance. Therefore, any new or persistent swelling in your feet warrants a prompt conversation with your doctor to determine the underlying cause. Another deeply uncomfortable and often maddening symptom that can manifest in the feet is intense itching, known as pruritus. This is not the ordinary itch of dry skin. It's often a deep, persistent itch that is not relieved by scratching and can be particularly severe on the soles of the feet and the palms of the hands. It tends to worsen at night, often disrupting sleep and significantly impacting quality of life. The root cause of this itch is tied to the liver's role in producing and regulating bile. Bile is made by the liver and stored in the gallbladder. It contains substances like bile salts, which are crucial for fat digestion. After a meal, bile is released into the small intestine. In a healthy person, most of these bile salts are reabsorbed at the end of the small intestine and return to the liver to be recycled. However, when the liver is diseased, its ability to process and transport bile is impaired. The tiny bile ducts within the liver can become blocked or damaged, causing bile to back up and its components to spill into the bloodstream. When these bile salts accumulate in the blood, they can get deposited in the skin. It is believed that the presence of these bile salts in the skin irritates the nerve endings, triggering the relentless sensation of itching. This is a systemic issue, meaning the itching can occur anywhere, but it has a known predilection for the palms and soles. Take a moment to look at the soles of your feet. Do you notice any unusual blotchy redness? A specific type of redness, called plantar erythema, can be another telltale sign of a struggling liver. The corresponding condition on the hands is called palmar erythema and is more widely known, but the same mechanism applies to the feet. This redness is typically most pronounced on the heel and the ball of the foot, and it might blanch or turn white when you press on it, with the redness returning once the pressure is released. It's usually not painful or itchy, just a visible change in color. This peculiar symptom is thought to be related to the liver's role in metabolizing hormones, particularly estrogen. The liver is responsible for regulating the levels of many hormones in your body, breaking them down and clearing them when they are no longer needed. When the liver is not functioning properly, it loses its ability to effectively metabolize estrogen. As a result, estrogen levels in the blood rise. These elevated estrogen levels are believed to cause the small blood vessels or capillaries in the skin of the soles and palms to dilate or widen. This increased blood flow to the surface makes the skin appear red and blotchy. While plantar erythema is a classic sign of chronic liver disease, it can also be seen in other conditions, such as rheumatoid arthritis and thyroid issues, and can even occur naturally during pregnancy due to hormonal shifts. However, in the context of other symptoms, it can be a valuable piece of the diagnostic puzzle. Closely related to plantar erythema are small spider-like markings on the skin called spider angiomas or spider nevi. These are formed by a central small red spot, which is a dilated arteriole, a tiny artery, with thin red lines or legs radiating outward, resembling a spider's web. If you press on the central spot, the entire formation will temporarily disappear, and you can see it refill with blood from the center outwards when you release the pressure. While they can appear anywhere on the body, they are most common on the face, neck, chest, and arms, the upper parts of the body. However, they can certainly appear on the legs and feet as well. Just like plantar erythema, the formation of these spider angiomas is strongly linked to excess estrogen in the bloodstream due to the liver's inability to metabolize it. The high levels of estrogen cause these tiny arterioles near the skin's surface to dilate, creating the characteristic spider-like appearance. Finding one or two of these is generally not a cause for concern, as they can sometimes appear in healthy individuals. But finding multiple spider angiomas, especially in clusters, is a significant indicator that the liver might be under distress and is a very common finding in patients with chronic liver disease, particularly cirrhosis. Perhaps the most well-known sign of liver dysfunction is jaundice, a yellowing of the skin and the whites of the eyes. This yellow discoloration can also be noticeable on the soles of the feet, especially in individuals with lighter skin tones. The yellow hue comes from a substance called bilirubin. Bilirubin is a yellow-orange pigment that is produced during the normal breakdown of red blood cells. Old red blood cells are broken down in the spleen, and the bilirubin they release travels through the bloodstream to the liver. In a healthy liver, this bilirubin is processed and conjugated, making it water-soluble. It then becomes a component of bile and is excreted from the body in the stool, which is what gives stool its characteristic brown color. When the liver is damaged, it cannot effectively process bilirubin. As a result, this yellow pigment builds up in the blood. When the levels become high enough, it gets deposited in the tissues, staining the skin, mucous membranes, and the whites of the eyes yellow. Observing jaundice on the soles of your feet or any other part of your body is a serious sign. It indicates that the liver is struggling significantly with one of its most basic functions, and it requires immediate medical attention to diagnose and manage the underlying liver problem. Your toenails can also serve as a window into the health of your liver. Two specific changes are particularly noteworthy: Terry's nails and nail clubbing. Terry's nails have a very distinct appearance. The majority of the nail, from the base up, appears a milky white or opaque, with only a narrow, horizontal band of pink or reddish-brown near the tip. It can look as if most of the pink nail bed has been erased. This change is believed to be caused by a decrease in blood supply to the nail bed and an overgrowth of connective tissue, both of which are linked to the systemic effects of chronic liver disease such as low albumin. Nail clubbing, on the other hand, is a change in the shape of the nails and fingertips. The tips of the toes and fingers become enlarged and bulge, and the nail curves downwards around the fingertip, resembling the back of a spoon. The angle at the base of the nail, where it meets the cuticle, also changes and becomes flattened out. While the exact mechanism of clubbing is not fully understood, it is thought to be related to changes in blood flow and the release of certain growth factors into the circulation, which can be triggered by a variety of conditions, including chronic liver disease as well as lung and heart disease. Any noticeable change in the color or shape of your toenails that is not due to a local injury or fungus should be seen as a potential systemic signal that is worth discussing with a healthcare professional. The final set of clues our feet can offer relates directly to nerve health. Many people with advanced liver disease experience symptoms of peripheral neuropathy, which is damage to the peripheral nerves. This can manifest in the feet as a persistent feeling of coldness, even when the feet are warm to the touch. It can also cause numbness, tingling, or a pins and needles sensation. Some people experience burning or sharp shooting pains. These symptoms often start in the toes and can gradually progress up the feet and legs. This nerve damage is a multi-pronged assault caused by the failing liver. Firstly, as we've discussed, a damaged liver struggles to produce and store vital nutrients. Deficiencies in certain B vitamins, particularly B1, B6, and B12, which are essential for nerve health, become common. Without these critical nutrients, the nerves cannot function properly and begin to degenerate. Secondly, the buildup of toxins in the blood, such as ammonia, can be directly toxic to nerve cells, causing further damage. This combination of nutrient deficiencies and toxic overload creates a hostile environment for the delicate nerve fibers in your feet, leading to the debilitating symptoms of neuropathy. Alongside this, people may also experience frequent and painful foot and leg cramps. These are often caused by imbalances in electrolytes like calcium and magnesium, as well as fluid shifts in the body, all of which are a downstream effect of a dysfunctional liver. Understanding these signs is the first step, but it's equally important to understand what causes the liver to get into trouble in the first place. For many decades, the primary culprit for severe liver disease was thought to be excessive alcohol consumption, leading to alcoholic liver disease. And while alcohol remains a major cause of liver damage, we are now facing a modern epidemic that has surpassed it: non-alcoholic fatty liver disease, or NAFLD. NAFLD is the accumulation of excess fat in the liver of people who drink little to no alcohol. In its early stages, it is simply a fatty liver, but it can progress to a more serious inflammatory condition called non-alcoholic steatohepatitis, NASH, which can then lead to cirrhosis, liver failure, and liver cancer. The primary drivers of NAFLD are the cornerstones of the modern Western diet and lifestyle: high intake of sugar, especially high fructose corn syrup, refined carbohydrates, and processed foods, combined with a sedentary lifestyle. This leads to metabolic syndrome, a cluster of conditions including insulin resistance, high blood pressure, and abdominal obesity, which puts the liver under immense metabolic stress, causing it to store fat. Other significant causes of liver disease include viral hepatitis, caused by viruses like hepatitis B and C that directly attack and inflame the liver; autoimmune hepatitis, where the body's own immune system mistakenly attacks liver cells; and genetic conditions like hemochromatosis, which causes iron overload, and Wilson's disease, which causes copper overload, with both minerals being toxic to the liver in high amounts. The good news in all of this is that the liver has an extraordinary capacity for regeneration. If the damage is not too advanced and the underlying cause is addressed, the liver can heal itself. This is where you become the most important member of your healthcare team. Supporting your liver begins in your kitchen. Adopting a liver-friendly diet means focusing on whole, unprocessed foods. Cruciferous vegetables like broccoli, cauliflower, and Brussels sprouts are superstars for liver health. They contain compounds like sulforaphane that help boost the liver's natural detoxification pathways. Leafy greens like spinach and kale are packed with antioxidants that protect the liver from damage. Garlic contains allicin and selenium, two powerful nutrients that aid in liver cleansing. Healthy fats found in avocados, nuts, seeds, and olive oil help reduce inflammation. And drinking plenty of water is essential for flushing out the toxins that the liver processes. Equally important is what you remove from your diet. The single most important step you can take to protect your liver is to drastically reduce or eliminate your intake of added sugars, high fructose corn syrup, and refined carbohydrates like white bread and pasta. These are the primary dietary drivers of fatty liver disease. Limiting processed foods, which are often high in unhealthy fats, sugar, and salt, and of course, avoiding excessive alcohol are also fundamental steps. Beyond diet, lifestyle modifications play a crucial role. Regular physical activity is a powerful tool for liver health. Exercise helps improve insulin sensitivity, which reduces the metabolic burden on the liver. It also helps with weight management. Losing even a small percentage of body weight, as little as 5 to 10%, can significantly reduce the amount of fat and inflammation in the liver. It's also important to be mindful of the environmental toxins you are exposed to, as your liver has to process all of them. This includes chemicals in cleaning products, pesticides on food, and additives in personal care products. Choosing natural alternatives and eating organic produce when possible can help lighten your liver's toxic load. However, the most critical step you can take if you notice any of the foot-related warning signs we've discussed is to seek medical advice. Do not attempt to self-diagnose. These signs are your body's request for help, and that help should come from a qualified healthcare professional. Your doctor can perform a series of blood tests called a liver function panel, which measures the levels of liver enzymes, proteins like albumin, and bilirubin in your blood. They may also order an imaging test, like an ultrasound or a fibroscan, to visualize the liver, look for fat accumulation, and assess its stiffness or scarring. These diagnostic tools are essential for getting a clear picture of what is happening and formulating a proper treatment plan. In conclusion, our feet are far more than just the structures that carry us through our day. They are sensitive barometers of our internal health, capable of reflecting the well-being of organs located far away. The swelling, itching, redness, and nerve sensations that can appear in your feet may be the first whispers of a liver that is calling out for help. By learning to recognize these signs, you are empowering yourself with knowledge that can lead to early detection and intervention, which are key to preventing the progression of liver disease. This journey is not about fear. It's about connection and respect for the incredible, interconnected system that is your body. It's an invitation to listen more closely, to look more carefully, and to respond with compassionate, proactive care. Your liver works tirelessly and silently for you every single day. By paying attention to the subtle messages it sends, even to a place as distant as your feet, you are honoring that work and taking a powerful step toward a lifetime of better health.